It's good to have you with us. China says a new type of coronavirus could be behind a mysterious pneumonia like outbreak that has sent 59 people to the hospital. The virus belongs to the same family of viruses that caused the deadly SARS outbreak in 2003. Preliminary tests conducted in China say this new virus, that hasn't yet been named, is behind the outbreak that began in December. Patients reported pneumonia like symptoms. The outbreak in the central city of Wuhan was linked to a seafood market in that very city.
Many of the patients worked at or visited the Wuhan Huanan seafood market. The city is around 900 kilometers inland from Hong Kong, but officials there have also put precautionary measures in place.
The border entry-exit control points have enhanced health surveillance and inspection. Medical personnel have been advised to stay alert and transfer and quarantine the suspected cases as early as possible. The Hong Kong Food and Health Bureau will keep in close contact with the World Health Organization.
China has been hit hard by novel pathogens in the past. The SARS epidemic in 2003 killed over 700 people in the region. Experts in China say they've already confirmed this is a different disease, one that appears to be less virulent. So far, there have been no fatalities among the reported 59 people who contracted the illness, but health officials remain on high alert.
We have conducted a risk assessment. We have activated the severe response level. Under this, in relation to new infectious diseases, the immediate effect on public health is moderate.
In the meantime, the number of confirmed patients has remained steady, and China's state broadcaster reports 8 patients were released on Wednesday after showing no signs of fever for several days.
And joining us for more is DW Science correspondent Derek Williams. Derek, welcome. Now, health officials in China are saying that they've identified the virus behind this outbreak, but it's one that's related to SARS. How serious is this?
Well, to some extent, you can see that it might seem serious on the surface because the SARS virus obviously caused a lot of damage. It infected back in 2002, 2003, infected over 8,000 people, killed upwards of 700, somewhere between 700 and 800 people. So it's in this family of what are known as coronaviruses. They're called that because of the way that they look. They resemble the sun. They have this corona around them of various sort of things that are leaving the envelope of the virus are extended around it. Now, coronaviruses belong to a family of viruses that cause everything from common colds to much more severe respiratory disorders. For example, SARS, or also related to MERS, Middle Eastern Respiratory Syndrome. Now, the new one, this latest one, what seems actually positive about it, or not as bad as the SARS virus, is that it's not, as far as they can tell so far, been transmitted human to human. That's one positive aspect of it. That's one of the things that causes an epidemic to begin. It looks like it's transmitted possibly animal to human, which these people got it at the seafood market in Wuhan. The second aspect of it that's actually positive, if you can talk in those terms when you're talking about a virus or viral infection, is that it appears to be not quite as virulent as SARS was. SARS, of course, killing around 10% of the people who contracted it.
So the risk of spread of the infection appears to be low, but despite that, regions, the countries in the region and other places have taken precautions against it, particularly Hong Kong, for example, where they've introduced screening of passengers coming in from the mainland. Can you tell us more about that?
Well, that's actually also another very positive development as compared back to 2002 and 2003, the SARS epidemic that happened, that began in China. China really tried to bury that particular story when it happened. It tried to quash it. But in the modern world, with the mobility that we have nowadays, that's absolutely actually the worst thing that you can do. What you need really is transparency, particularly with major international organizations, with the WHO. You need to be coordinating with them, and people need to be alert and they need to be aware. And it seems like China really learned that lesson, and they're releasing information as they have it. They also figured out genetically quite quickly what this bug is. It's not an easy thing to determine with a lot of pathogens. And they've shared that information fairly quickly. People are on alert, but for me, it looks like actually things are at the moment certainly under control.
But overall, how does this happen? A new disease emerging seemingly out of nowhere.
Well, diseases do regularly jump what's known as the species barriers. These are what are called zoonotic diseases. The thing about that you have to understand about pathogens or about single-celled microbes that live within us, we're their hosts, we're their universe. It's not in the interest of the microbe to kill us. You don't destroy your own home. And so actually what's happening is that within hosts, for example, a natural host, a microbe will only cause actually not terrifically powerful symptoms. The problem is when it jumps to us, often our own immune systems will tend to overreact. And
Right.
to some extent, the crash happens because your own system is confronted with something it's never had to deal with before and goes into overdrive.
Derek Williams, thanks very much for coming in and explaining that to us.